If you're missing the neglected range of motion of knee rotation, also known as tibial internal and external rotation, you're putting a lot of stress on your meniscus and you could be putting your ACL at risk of injury. In this video, you're going to learn why this is and some exercises to restore this little known and important range of motion. Coach E from Precision Movement here, and today I'm going to talk about one of the topics that I love to cover here, and I think that we do a uniquely excellent job here at Precision Movement at covering, which is the neglected ranges of motion, muscles, and movements that we need to move freely and without pain. I'm also going to be backing up what I talk about with some science, and then we're going to get into some unique and effective exercises that you can do at home to fix this neglected range of motion, which is one of the phrases I often say is use it or lose it. This applies to everything in life, so it applies to everything in our body. When it comes to tibial rotation, yes, it applies to use or lose tibial rotation itself, but then all of the things that are affected by tibial rotation. The first thing I want to talk about here is the meniscus. If you lack tibial rotation, your meniscus isn't going to experience as much movement as it normally should in your everyday life. And because of this, it's not going to get those forces going through it, and those tissues aren't going to adapt and stay strong and pliable. In my research for this video, I found a great study that explains exactly this. The title of the study is Assessment of Tibial Rotation and Meniscal Movement Using Kinematic Magnetic Resonance Imaging. And kinematic MRI is basically being able to do an MRI and record it live. So you can see the movement of the structures as you're doing the MRI. In the study, the researchers found that the tibia rotated internally around 11 degrees during knee flexion and rotated externally around 11 degrees during knee extension. The important point here with regards to the meniscus is with knee flexion, the medial and lateral menisci moved backward and the height of the meniscus increased. The movement range was greater in the anterior horn than in the posterior horn and greater in the lateral meniscus than in the medial meniscus. What the study showed is that as you flex and extend your knee, you have natural internal and external rotation of the knee, and through that, the meniscus gets pressed, crushed, and deformed in various ways. But if you're lacking the internal and external rotation of the knee, then you're not going to get those same forces going through the meniscus, and use it or lose it will apply. And when you lose the pliability, that's when tears can more easily occur. The second key structure affected by tibial internal and external rotation is the ACL, or anterior cruciate ligament. The same use it or lose it phenomenon that applied to the meniscus can also apply here, whereas if you're not going through full tibial internal and external rotation, especially external rotation in the case of the ACL, then that ACL is not going to get the stress that it needs to stay pliable and stay strong. Ligaments are very similar to muscles and tendons in that they need force to maintain their strength and their pliability. Now, when it comes to the ACL, we know that the ACL is most at risk in sports that involve high speed, cutting, and changes of directions like soccer or basketball. A study titled Revisiting the Role of Knee External Rotation in Non-Contact ACL Mechanism of Injury created a model of an ACL and tried to see where it would be under the most stress and thus risk of injury. And the results demonstrated that the peak stress and strain occurred at the mid portion of the anteromedial bundle, with the higher values being obtained under a combined knee valgus, flexion, tibial external rotation, and high axial load. So it's clear that tibial external rotation puts stress on the ACL. And when we use that external rotation through our normal daily life and through exercises that you're going to learn, we're putting good stress through the ACL. These tissues, we need to stress them to make them stronger and to keep them strong. But if you lack this tibial rotation movement, then use it or lose it applies, and a couple things will happen with the ACL. Number one, because it's not getting stressed, it's going to get weaker and you're going to lose that pliability. So it'll be able to snap easier than if it has pliability, it'll stretch more before giving away. And number two, what'll happen is if you're really lacking the range of motion through the knee joint, that tibial internal and external rotation, when you're using it, you're going to hit a barrier. You're going to hit a hard barrier where you don't have that range of motion anymore. But if you break through that barrier, it's going to be a sudden impulse. And that's a high amount of force in a short amount of time. And when you do that, you'll break through the bony barrier of the joint and then you'll get quickly into the ACL, which will result in excessive stress on the ligament and a good chances of it popping. So enough fear mongering. What can we do about it? Well, we can do exercises. So now we're going to use the tibial internal and external rotation. That's going to help us to use the meniscus and use the ACL and to keep those tissues healthy and pliable. The first exercise is going to mobilize the tibiofibular joints. So there's two tibiofibular joints, one proximal, which is up higher, one distal, which is down lower. For the proximal one, you want to kind of grab, and it can be really sensitive, this bone right here. This is the head of the fibula. You want to grab just below the head of the fibula and just kind of push it back and forth this direction, anterior, posterior. And it can be stiff and painful, and you'll get some muscles that are really nasty in that area, which is good because we're digging in there, and that's always a good thing to keep those muscles pliable. So you're grabbing it and you're just mobilizing it for about 30 seconds. And if you put your other hand, notice I've got my other hand up here and to the lateral side of the tibia, I could just feel the movement going. A little bit of movement. I just do that because I like to feel it moving. So do that for about 30 seconds. Then we're going to mobilize down here. It's a little harder to get right into the tib-fib joint distally. So what I like to do is just grab the whole lower leg and just rotate it. Just bring it out. So this again can be kind of painful, but it makes sure that that joint at least has a little bit of movement there. So just 30 seconds up top, 30 seconds down low, do both legs, and you're ready to go. Now that we've done some joint mobilization, we're going to activate the muscles so that any movement, extra movement that we got with the joint mobilizations, we can make it stick, and we can train the muscles and the brain to use and to keep this new range of motion. For that, we're going to do the seated tibial rotation exercise. For this exercise, you can go both at a time. And what you're going to do is put your fists between your legs here, and you're going to keep that distance between your legs. Now you can keep your fists here if you want, or you can remove your fists and just make sure that your knees don't move in or out as you do the exercise. It's up to you. You're going to pop your heels just off the ground, maybe a centimeter off the ground, and then you're going to rotate the heels out, so you're spinning on the balls of your feet as you're kind of pulling the ground towards your butt. You don't have to pull too hard. But what that's going to do is going to activate the hamstrings, which are the muscles that contribute and perform the movements of tibial rotation. Hold it for 5 seconds, so you're pulling the ground towards you, underneath you, as you're rotating the heels out simultaneously. And then keeping the knees right where they are in space, you're going to rotate the heels towards each other. So this is tibial external rotation. The heels are going in, but the tibia is rotating outwards. And again, you're pulling the ground towards you, activating the hamstrings as you're rotating the heels in towards each other. So you're switching back and forth, always pulling in as you're rotating and working at that end range of motion. Don't just sit there. I'm working, trying to activate those muscles as much as I can at the end range of motion. Going slow back and forth, making sure the knees stay equal distance apart and feeling the hamstrings work. So as the heels are close together, you'll work more the lateral hamstring. And when the heels are further apart, you're working more the medial hamstring, so the inside. So you can feel that area, poke that area, prod that area to try to wake those muscles up and teach them that this is what you're supposed to be doing. Work this tibial internal and external rotation range. After the seated tibial rotation, I like to do the supine version. And the reason why is because this starts to really train the knee screw home locking and unlocking mechanism. So that's when you straighten your knee, it's got to rotate a little bit to fully straighten. And when you bend it, it's got to rotate a little bit to get out of the fully straightened position. That was explained in the study as well. So this exercise, supine, you're lying on your back. You're going to flex your hip to about 90 degrees. And you're starting here, letting your knee relax, your heel drops towards your butt, and go into, let's go tibial external rotation. as far as we can. So we got the hamstring fired up to do that. And then fully straighten the knee, keeping that rotation until the very end where it goes straight. And then you come back fully flexed and then go to internal rotation. And then straighten it out. The knee will lock and it'll be straight. And then you'll start to bend it and it'll unlock. Again, you just go back and forth. External and internal rotation. So here we're just making sure that we have sufficient range of motion through the flexed portion. Your knee doesn't rotate when it's perfectly straight. It's locked, it's nice and stable. We want to keep it that way. But once you start getting into the flexed knee or the bent knee position, that's when you unlock the tibial internal and external rotation. So we're just training that with this movement. And it's also a more quad dominant movement versus the previous exercise, which was more hamstring dominant. So we're able to train this rotation, derotation range of motion with these different patterns. And the more patterns that we can train this range of motion with, the better we can make this range of motion stick. The final exercise is the one leg tibial rotation squat. Now, word of warning, if you've got current meniscus or ACL injuries or pain, do not do this exercise, or at least you can do it, but don't push it into any painful range of motion. Even if you don't have any of these injuries, don't push through a painful range of motion because this can irritate it. However, if your knees are good and you want to keep them that way, then working this type of exercise is really good because, again, use it or lose it. So for the tibial rotation squat here, I'm going to start off with my short and skinny foot. So if you don't know how to do the short and skinny foot, look in the description and find the link to our other video, which teaches you all about that. I'm not going to go through that every time I do a lower body exercise. So short and skinny foot, start off with the knee straight, knee locked, and I'm going to start off with tibial external rotation. So external rotation is when my knee goes in, so it looks like my tibia, you can see it's externally rotated relative to my femur. And I'm going to drive it around in a circle and then come up the middle and then straighten it out. Internal rotation, I'm going to drive it to the outside, circle forward, and then come right up the middle. Now this whole time, I've got most of my weight up on my front foot. I've got the short and skinny foot, aka the metatarsal pressure, which I talk about so much. And I'm keeping my foot balanced on the ground. I'm not rolling to the inside of my foot. I'm trying to keep balanced on my foot as I go inside and as I go outside. So as I go inside, your tendency, you're going to want to lean towards the middle of your foot here. So try to press down more on the lateral or outside aspect of your foot. And as you go to the outside, you're going to want to go more on the lateral aspect. So try to press down the medial aspect of the foot. So what we're doing here is we're integrating the movements, the activation patterns that we got from the first two exercises into a closed chain functional movement. Because like we went through earlier, where does the ACL get injured? It's when you're doing this. It's like you're running, you're planting. You got the valgus knee combined with tibial external rotation with knee bent and high forces. Running, boom, turning, and blowing your ACL. So we're training this exact range of motion, but we're going slow. So we've got muscular control throughout the full range of motion. When we have that muscular control, that's when we can keep the ligaments safe and at less risk of injury. So now you know about this neglected range of motion called tibial rotation, and you've got exercises to make sure it's there for you when you need it. To summarize the exercises, we've got the tibiofibular mobilization. You do 1 minute per leg with 30 seconds at the top and 30 seconds at the bottom. Then we've got the seated tibial rotation. For this, you can do 2 sets of 4 to 6 repetitions, holding for 5 seconds in each direction. The supine tibial rotation can be done for 2 sets of 4 to 6 repetitions per leg. And you could finish off with the 1 leg tibial rotation squat, doing anywhere from 2 to 3 sets of 4 to 6 reps per rotation per leg. There you have another neglected range of motion that will no longer be neglected. Hope you enjoyed this video. And I mentioned a couple other resources previously, and I'll drop those in the links here and some more in the description down below. But if you've got knee pain, the most important thing you can do right now is to get started on our knee pain solution, which includes concepts like you learned here on tibial rotation and many others that are similar, that are neglected, that need to be worked for pain-free and healthy knees.